Hi everyone, my name is Dr. Amna Husain, board certified pediatrician, board certified lactation consultant, and mom. Today we're going to be talking about one of my favorite parenting tricks, swaddling, and the best practices when it comes to swaddling your baby. So if you're a parent, you've probably been told in the hospital or maybe by your pediatrician that swaddling can be very helpful. Some parents insist that swaddling doesn't work well for their baby, and that might be up to them. I personally find that swaddling works well for almost 99.9% of babies. It's just all in the technique about how to do it. However, it's very important that you review this technique because doing it the wrong way could lead to something called hip dysplasia. More on that later. Let's first talk about the benefits of swaddling. Many parents find that swaddling can help calm a fussy baby, reduce crying, diminish a startle reflex, which can then interfere with sleep patterns, and then generally just lead to more restful sleep. Generally, we do recommend stopping swaddling when your baby's able to roll over consistently because it then becomes unsafe with the risk of potentially suffocation. Now, I did discuss that improper swaddling could potentially lead to a condition called hip dysplasia. Let's talk about what that is. Hip dysplasia means essentially when the bones of the hip joint are not aligned correctly. This potentially allows the joint to become loose and move out of the socket. So the hip dysplasia could be a hip joint that's in actually a shallow joint or one that's completely out of the hip socket. Now, the baby won't necessarily be in pain. It's actually a painless condition, and it's something that pediatricians screen for initially during the newborn period with a thorough hip exam. When caught early, these are referred to pediatric orthopedic surgeons who can then actually treat it and follow the child with a splint or a harness. Now, swaddling is not the only thing that can cause hip dysplasia. Actually, there's a couple of factors. So family history, positioning in utero, potentially breech babies or a breech delivery, and even conditions like club foot can be associated with having potentially a hip dysplasia. That's why it's so important to screen for this condition early on in baby's life and continuing to screen at checkups. So the key when swaddling a baby, this is going to be a 4-month-old baby who usually isn't swaddled, but just for the sake of demonstration, you can do it this way with one of the hospital receiving blankets. I have it in a triangle shape. And what you want it to be is snug across the top. Snug across the top and loose at the hips. So you snug it across the top, and once you have one arm down, I actually like to take this time and bring the lower corner of your blanket up. But before I do that, I want to show everybody. So this is how the hip should be. Not straight like a cigar, but instead bent. That allows for normal hip development so that they're not locked out. And you're going to bring this up, and you can bring this across as well and fold under the baby. Now, in a newborn stage, they can still break out of it as well. You can definitely tie this, tuck it in. There's different ways that you can do it. The other method of doing it, if you don't have a receiving blanket, because my kids usually break out of the blanket, and my personal favorite is with one of these sleep sacks with Velcro on them. So this one is again for probably a 0 to 3-month-old baby, and she is 4 months old right now, so we'll see how this fits on. But once you get baby in, you want it to be loose enough in the hips so that they frog leg out. And again, why I like the Velcro is it's easier, but you can make them come under like this and fold across this way and stay tight across the top, but loose at the hips. And the last one that you can use that is also hip safe and sleep safe is another brand I have. It's the Halo Sleep Sack, but these are all pretty much kind of made in the same way. So this is again for a baby that's about 3 to 6 months old, so she should fit in this pretty nicely. But you would be able to put the arms out once they are no longer going to be swaddled. And the way this one would work is once you zip it up, it's actually kind of nice because you would just fold across the top. Of course, once it's zipped up, right, she's giving me issues, but fold across the top They might still be able to break out of the Velcro if your kids are a little stronger, so that's why I like option number 2. But you would fold it across the top, still hip safe so that the knees can bend, and tie it across the top. It's just about how tight across the top that you can really get it. And when you're done using the top portion and your baby's flipping over, you could just Velcro across the bottom underneath the arms. So just like I mentioned, you generally stop swaddling baby after baby begins to roll over, because then it becomes unsafe and could potentially become a suffocation risk. If you have any questions on swaddling, make sure you ask them below. Tune in next week for other videos. That's it. Okay, bye.